All right. Hello, hello. Good morning, good afternoon. I see everyone is trickling in. Please feel free to introduce yourself, your name, pronouns, where you're zooming in from, and what your role is. That would be great. Welcome, welcome everybody. All right. Well, thank you all for coming to today's PACT session, Peers and Clinicians Together. Today's topic is switching from object to subject, an evolutionary approach to Black mental health and wellness. I am so excited for today's session, and we will have two special guests of honors that I know you will enjoy. My name is Evelyn Clark, and I work for the NTTAC Center and Change Matrix. We are a partner, and I am zooming in from Olympia, Washington, the land of the Coast Salish and Squaxin people. All right, next slide, please. Thank you. So our disclaimer today is that the views of today's presentation do not reflect our federal funders. And just in case there is a security issue, we will get off this line and send you a new link through email. All right, I see everyone coming in. Thank you, thank you. So thank you for coming again to NTTAC, the National Training and Technical Assistance Center session today. These are our partners that work across the center to provide you with technical assistance and support. Our vision and services on NTTAC are that all children, youth, and families living with and impacted by mental health challenges will have access to the resources and opportunities they need to thrive in a comprehensive and equitable system of care. So again, we provide technical assistance, individual consultation, we have communities of practice, we have these PACT sessions, we have 5 Things Digest, lots of great things to offer you. And we're going to share the link to our website so that you can sign up for our free newsletters. And again, so look for a follow-up email after today's session, and we will get you a copy of attending, as well as any of the credentials we are providing. Again, welcome to today's session, Switching from Object to Subject, an evolutionary approach to Black mental health and wellness. This is in honor of Black History Month, and we also want to recognize that Black Mental Health and History Month is every day of the year. Oh, I'm super excited to introduce you to today's presenters, Dr. Dion Coker-Apaya and Dr. Tanisha Freeman Foster. And they will get into a little bit more of who they are in just a minute. So for today's agenda, there will be an activity titled, What Would You Do? Then there will be breakout sessions and share-outs. And then they will be discussing Black mental health and wellness and why it is important. Then they will go into liberation-based healing practices and provide an overview of evolutionary practices. And then there will be time for questions and answers from all of you who are joining us. And then we will close out today's session. All right, so I'm going to hand it over to our wonderful doctors to do the activity and also introduce themselves as well. Thank you.
Good. You want to introduce yourself first, Tanisha?
Sure. Good morning. Good afternoon, everyone. Dr. Tanisha Freeman Foster. I am the co-founder and CEO of Lead Us Well, and I am located in Tampa Bay, Florida, which is the land of the Seminole people. Thank you so much, Evelyn, for the opportunity to serve as a co-facilitator here today. And also, Dr. Dion, thank you so much. Happy to be here.
Thank you, Dr. Freeman Foster. And I'm Dr. Dion Kokorapia. Excuse me, I'm an adolescent psychologist by training, and I'm also an associate professor in the Department of Psychiatry at Georgetown University School of Medicine. And I also serve on the NTTAC team with the Community Wellness and Peer Support Transformation team. And I'm so honored to be here to share some of this exciting work with you all today and to be partnering with my esteemed colleague, Dr. Freeman Foster, in this effort. So welcome, and we hope that we will be able to have an engaging discussion with you all today. I'll turn it back over to you.
Thank you so much. And so, as Dion just said, we're going to have an interactive session. So, the first thing we're going to start off with is an activity. And the name of this activity is What Would You Do? And so, the question is three things. Please take a moment to find a piece of paper and a pen or a pencil or something to write with. And so, the question is write down three people, places, or things that cheer you up when you are not feeling your best. And so it could be three people, it could be three places, could be three things, or a combination thereof. So we will pause and give you a moment to think of those things. All right. So if you feel comfortable, if you're still writing, please continue to write. If you feel comfortable, please share one of the things that you wrote down, something that you feel comfortable with, one of the things that you wrote down in the chat, just one. All right. So I see the ocean, I see kids and pets, grandbabies, the beach, dancing, music, prayer, the park, sunshine. Hopefully, we'll get a little bit more sunshine soon. I know it's been cold in a lot of different places. Cat, family, music. And so there is a theme here being outside in nature, being with pets, being with family members. Looks like traveling to St. Lucia. Spouse. I see a lot of nature and being outside, being at the library, being at home. And so think about how you would feel if I came in as your therapist or as your mental health support person and asked you for this list of three things. And then I sat and I looked at that list and I told you that none of these things mattered because I had the perfect solution to help you feel better. No worries about these things. We got you. And I took that piece of paper and I tore it up into little pieces and threw it in the garbage. How would you feel about that? And you can share that in the chat. And thank you all so much for participating. I see annoyed. I see there is no perfect solution, dismissed, defeated, sad, insulted, dismissed, surprised. Someone will be upset, feel disrespected, and leave. And so what we want to do is we want to ground you in this activity and really think about this. And so while this activity was just blatant and say, okay, list three things. Now imagine me tearing it up. A lot of times it doesn't happen like this in sessions, but it does happen. And so while we don't have people write things down and tear it up and throw it in the trash, we just ignore it. Or we say, this is what we've learned through this evidence-based practice, or this is just how we do things here. And here are some other things. And so while the blatant tearing it up and blatant disrespect doesn't happen in that way, it happens over time. And it creates a process that erodes that individual's humanity and it degrades them and their ability to be able to heal themselves. And so thank you again for participating. What we're going to do next is we're going to move into some small breakout rooms. And so again, we said that this was going to be interactive. We are keeping to our promise. So we're going to move into small breakout rooms. If you're unable to participate in your breakout room, please come back to the main room. Here are the instructions for the breakout room. Please take a picture of these with your phone so that you have these. So in your breakout room, what we're going to ask you to do is introduce yourselves, and these will be small breakout rooms. So it'll be 2 to 3 individuals in each room. And reflect on the scenario, reflect on what just happened and how you felt. And in your small group, discuss the following question. In what ways might this situation affect mental health stigma, beliefs, and the decisions for the client? And then if you have time, select one of these questions. Either how would you address the situation with a colleague or supervisor? So if you were a staff person, what would you say to your colleague or supervisor about this, about what just happened with that client, if you were a bystander in that? Also, the other option is to walk into this as a client. In a client's shoes, how would you address this situation? What would you do? Who would you tell? What would you say? And how would you say it? And so again, please make sure you take a picture of this slide. So next we will move you into your small groups. And you should see a screen that just popped up on your screen. If you do not see it, please let us know and we can manually put you in a group. And we'll be in there again for 5 minutes.
Hello, I'm sorry, I came in a little late and I was having audio issues. Is this a breakout room?
Hi,
No.
Bernardino. They're coming back in now. Thank you for letting us know.
Yeah, I was meeting with the leadership. I apologize for being late.
No worries. Thank you for being here. Right. So welcome back, everyone. And we know that there were a few people who were unable to hear the scenario. And so for the purpose of just understanding what just happened, we will do a recap. And so the recap is, and if you, okay, thank you. I was just going to ask everyone to mute themselves. So the recap is, imagine that you were asked to write down 3 things, 3 people, places, or things that help to cheer you up when you are feeling sad or not feeling your best. And you go in for support services or mental health, mental wellness services, and the person asks to see that list. And they review it and say, you know what, we're good. You don't need anything on this list. We have this evidence-based practice that's going to help you feel better. And they take that piece of paper and rip it up and throw it in the garbage. And so in the breakout rooms, the goal was to reflect on in what ways might this situation affect mental health stigma, beliefs, or decisions for the client. And then if the group had time to look at the situation from the lens of a colleague or supervisor who was aware of the situation, or as a client, how would you address that situation? And so now we will move into our large group discussion. And we'll start with our chatterfall. Please share a key takeaway from your small group discussion in the chat box. And if you would like to share, we have time for 2 individuals to share what were some takeaways, either from your time in your small group breakout or just from this scenario in general. So if you raise your hand, we can call on you. I see, is it Vita?
Vetsa.
Veta?
Better.
Veta. Hi, Veta. How are you?
I am good. How are you?
Good. Thanks for sharing.
No problem. So what I took out from this little group discussion with Tracy and Chris, um both of them have done this activity before, and I learned from them how different perspective can affect a lot of people, as well as how it emotionally affects clients when, because they write something personal, and at the same time, we're taking a piece from them. And when we do, that we might not see it as a bad thing, but to them, it's a whole different meaning because it's something that they shared with you on one-on-one, and as well as how we would talk about it, because they were first scared of being judged and everything, and once they wrote it down, and once it was taken away, it it kind of had that emotional affection, and then how I would have handled it with the client or with the task, talk to one-on-one, see a different point of view, like why it affected that much, why was it emotional, and why was that important piece key to the individual.
Thanks so much for sharing that, Veta.
No problem.
Jamie.
Hi everyone, it's Jamie and nice to see everyone again. Some of you actually, but anyway, I want to say that when you go in as a room as a peer, I have a clinician with me, the other group, and also a supervisor. I mean, people who have experienced more than me. And I just want to say, invalidation seems to be the theme that we face. Being heavily like when you come in as a person of color, BIPOC person, being a peer and also trying to bring a narrative in the equation. It's always hard when the clinician perspective always dismiss you, even though you are like trying to show them there's not one size that fits all. Like we are all different and we like to be heard in our own being. So we are not taking your jobs away, clinicians. We are trying to complement your work. But how do we make it in a way that succinctly that we can help each other? How can we make it in a way that a person of color, because of the linguistic challenges, because of the cultural stigma, doesn't take away that kind of say into our discussion,
Mhm.
So I think being a peer, I firsthand undergo it myself. So that's why I think we need to find a way that we can actually how to help each other and just validating our roles and our contribution as valid, like to be a supportive of each other, in other words. Thank you.
Absolutely. Thank you for sharing that.
Thank
And
you.
we see in the chat, and we're going to talk about that, about having a partnership and really removing this hierarchy of you come and sit down and somebody tell you how to live your life, but more of looking at it from a partnership role where the client and the patient and the participant leads that care. And we see in the chat note, we are noting that the time was really quick and
Yes.
people were just getting in and talking. And so we will make note of that, and we will provide additional information on similar conversations going forward.
Yes. And at the very least, next time, a little more time for the
Yes.
breakout, if we can. Yes. This is wonderful. Thank you all.
Yeah, and thank you for sharing in the chat around EVPs and disregarding individuals and how these things exacerbate stigma. And Jamie, I see you getting a lot of kudos in the chat for the points that you have brought up. So thank you again.
Yes. And I like this one from Tandra. As a counselor, you have discredited your voice to your client to be able to receive from you. Absolutely. Absolutely. Okay. Well, we'll be sure to go through all of these comments. So I'm going to hop in here and briefly talk a little bit about why it's important to have these discussions about Black mental health and wellness. And we'll share some stats before we move on and spend a bit more time on some what we're calling evolutionary practices. So all of this is on the slide. It's a lot, but I'm just going to sort of try to summarize and discuss as opposed to reading all of this, and just highlight some points that we need to keep in mind when we're thinking about Black mental health and wellness. And the first thing that I want you all to keep in mind is this disparity between Black individuals for whom a diagnosis of a mental disorder where they meet diagnostic criteria is met, and the number that actually receive treatment as compared to their white counterparts or counterparts from other racial ethnic groups. There's a huge disparity in that number, so we really have to keep in mind the disparity between individuals who need treatment and those who are actually receiving treatment. And some of the exercise that you just went through could be some of the reasons why that is happening, because when they're entering into those spaces, they don't feel seen. They're not seen, they're not heard, they don't feel respected. And so why would you volunteer yourself to be placed in a situation like that that's going to actually make you feel worse than you did when you sought treatment? And so the disparity is a huge issue that we need to keep at the forefront of our minds when we're talking about Black mental health and wellness. The other important issue is that of suicide. Suicide is preventable, yet it's the third leading cause of death among our young people between the ages of 10 to 24 and African American men between the ages of 25 to 34. We really need to think critically about suicide prevention efforts, particularly as it relates to our population. Another thing that I want you all to keep in mind is that this disorder of PTSD, our people are disproportionately impacted by PTSD symptoms because we are disproportionately impacted by trauma. And a lot of that trauma is grounded in racist experiences and racist institutions and racist structures that we have to endure on a daily basis. So it makes sense that individuals are developing PTSD-like symptoms because they're experiencing trauma at rates higher than their counterparts. And so we really have to understand how these symptoms develop so that we are able to then create interventions that actually address the real problem and not try to avoid the real issue. And for many of our patients or clients that we see, discussing the impact of racism is avoided. And we definitely need to move away from that and have those uncomfortable discussions about the impact of racism on Black mental health and wellness, because racism is actually an ACE. It's considered now an adverse childhood experience because it's so prevalent in our community and in our society. So we have to be mindful of trauma and PTSD symptoms as well as it relates to our communities, our population, and individuals. Tanisha, you want to take the next one?
Absolutely. Thank you. And so one of the things that we found too is that physicians were more verbally dominant and less patient-centered in their approach with African American patients than with their white patients. And so what this does, it creates that effect that we had in the scenario earlier, where you ask someone about themselves, ask them what helps them, and then you take it and rip it up. And so while it's not that blatant, if you come into an appointment and someone overtalks you and assumes that they have the answer to what's going on in your life without even hearing your full story, it creates this environment where there is a need to feel that you are fixing someone, that this person does not have any strengths on their own, that they're broken, and that I need to fix them because they don't know how to fix and heal themselves. And that puts patients in a position where they're unheard, they're unseen, they're unvalued. And a lot of times what I've seen is people leave with medications. They have no idea what those medications are for. They take them and it may make them sick and they don't take it anymore, or they never come back because the things that were given to them as solutions are not even culturally responsive. And it's things that they would never do, things that they would never eat, activities that they would never participate in that have been offered to them. And so they're not coming back and it's not going to be effective. And so that's something we have to be aware of, that we may not be ripping up that proverbial piece of paper, but just out talking someone and not listening to their story is a way in a form of slowly degrading their humanity.
Mm-hmm. And just to follow up on what you just shared, Tanisha, I really believe that this is a critical opportunity for training. I think that we have mental health professionals who need to be trained differently. For example, at Georgetown, our medical students, the first day that they're on campus, the first day of their first year of medical school, they have to enroll in a course that's called physician patient communication. And we teach students from day one basically how to develop a bedside manner, how to be respectful of patients, how to allow patients' voices to infiltrate the room, how to listen. Because if they go through medical school and all of their additional training and they don't have this particular training, they've already developed these mannerisms and behaviors that we're talking about today. So if you catch them early on in their training and teach them why this is important and necessary and appropriate, then we might have a chance here. But I think that there's a huge opportunity for training with that particular bullet point. And I'm going to follow up here with another point that I want everyone to remember, and that is around this whole idea of misdiagnosis, underdiagnosis, and overdiagnosis, and understanding that individuals in the Black community are often overdiagnosed with particular mental disorders, underdiagnosed with others, or just not diagnosed at all. And then to add to that, they also don't receive therapeutic modalities in a manner that's consistent with their counterparts or even with the general population. So they're offered medication differently, as Tanisha just mentioned. They're offered different types of therapeutic interventions that are just not aligned with who they are as human beings. And that is a huge problem. So we want to keep this whole idea of diagnosis at the forefront. And many of us in our clinic, we are really we struggle with the whole concept of diagnosis, particularly as it relates to patients, clients of color, for this particular reason. And then, Tanisha, you're gonna take the last 2 points.
Yeah. And so just to double click on that, is underneath all of this is a mindset. And that's something that we cannot neglect. There's a mindset and there's a belief that is occurring when we meet with individuals who are may look like us or differently from us. There's a story. And in order to provide premier health and wellness services, we have to interrogate that story. And so this particular stat speaks to that about Black and African American people with mental health conditions, specifically those involving psychosis, are more likely to be in jail or prison than people of other races. And that goes back to the story. So these individuals behave in this way, and certain individuals are deemed to have mental health challenges, and others are deemed to be violent and aggressive. And we can look back at the history of mental health and mental illness and look at the different types of advertisements that were out about schizophrenia and about psychosis and how they portrayed Black men as angry and dangerous. And so if we lead and we enter situations with that lens, then there's no doubt that we're going to have a disproportionate number of Black and brown individuals incarcerated, because the belief about rehabilitation or the belief about the foundation or the intent of their behavior is different. And so they're going to be in jail and not in your rehabilitation clinics or not receiving mental health treatment. And so we also want to highlight here that a 2021 study proposed that African American youth would benefit from the incorporation and support around cultural experiences, attitudes, and values. And so, as Dion just previously talked about, is sometimes we tiptoe and we walk around racism. We walk around the thing that affects individuals. And so if something is affecting an individual's outcomes or of the way they experience life, we cannot skate around that. And we'll lead into that as we go forward. It's important to incorporate that into that person's treatment. And if you're not the person, then we need to find that within the organization. And so that leads us into this next slide of holding up the mirror. And based on this, we see a lot of organizations don't have a lot of diversity. And so looking at this chart, basically what we did is we looked at the number of individuals based on race who were receiving services with any mental health diagnosis. And we overlaid them on top of mental health occupations. So we'll see social workers in orange, we have counselors in gray, and we have psychologists in the gold color. And so starting with white, we see that there is 48% of recipients receiving mental health services. And the number of professionals that are white outnumber that. So that means that most of the time, anytime a white person goes into a clinic, they, by a larger, greater percent, are able to see someone who looks like them. And we see that start to decline. So we look at Black, and we see that 31% of Black people accessing services only have access to 21% of the individuals are Black social workers, 18.8% are counselors and psychologists. And so we're not going to go through every one, but what we wanted to highlight is who has an opportunity to work or receive services from someone who looks like them. And after white, it just starts to decline. And we see with American Indian and Alaska Native, it's almost zero. And we see that with Native Hawaiian and other Pacific Islanders. And so we ask ourselves why people are not showing up. And for me, this highlights that if I can't see someone who looks like me, then why am I showing up to explain my life to someone who may not understand? And so this goes back to organizations, workforce development. How are we increasing the pipeline from college or high school into our workforce and make sure that people have options and people have choices?
Wonderful. Thank you so much. It's really eye-opening. I mean, to see it on the graph, what we already know exists in real life, to see it there is really eye-opening.
Yeah.
So now we're going to shift our discussion a little and begin to talk about what can we do about this? Like, how can we as mental health professionals, as other professionals who are working with this population, what can we do to sort of move us in the right direction? And to just ground us a little bit, I'm going to share an approach that we are beginning to use in our clinic, which is called liberation-based healing practices. Some of you all may be using some of these practices already. If you are, I would love for you to share in the chat. But I'm just going to give you a brief overview of what it means to use this lens when you're thinking about treatment and therapeutic interventions. Next slide. And the reason why the title of our presentation today is Switching from Object to Subject. A basic fundamental foundation of liberation-based health or liberation psychology is that we have to have a paradigm shift. We have to shift our thinking from an object-focused thought process or intervention method to a subject-focused thought process or intervention method. Meaning, when we are working with our patients, our clients, our consumers of mental health services, we have to stop looking at them as objects to be manipulated, because they are human beings. They are subjects that we need a collaboration with them. We need to join with them. We need to engage them. There has to be a more collaborative approach, because they should not be manipulated. They are not objects. And I think that the way many of our individuals are being treated is as objects, and that's why they don't show up. I wouldn't show up if I knew I was going to walk into a space and someone was going to try to manipulate my human beingness. I would not do it. I'd rather enter a space where I know that someone is going to hear my voice and listen to what I'm saying, understand my lived experience, and then work collaboratively to figure out how do we make all of this fit together with a plan that works for me. Liberation-based healing practices are grounded in anti-racist foundations. That's critical. You have to be anti-racist. I mean, we just talked about how racist experiences cause trauma, which then lead to symptom development, which then lead to mental health disorders such as PTSD and other mental health, or a wide array of mental disorders. So it's grounded in anti-racist foundations. We also have to have some sort of structural competency. We have to understand and know and acknowledge structural factors that impact mental health and well-being, particularly as it relates to Brown and Black people. We have to use an intersectionality lens. We are multidimensional beings. We're not unidimensional. So we are made up of so many different identities. And if our providers don't take the time to understand those identities and how they all work together to inform our lived experience, then to me, that's a deficit. That's a deficit, and you're not able to fully conceptualize your patient. You're not able to understand what they're bringing into the space, and you're certainly not able to develop a treatment plan that's going to work for them. And aligned with that is that we need to focus on that lived experience. Lived experience is important. It's what makes us who we are. It's what we're bringing into the room. It's what we have to work with. So you need to take time to really delve in and deconstruct that lived experience so that you understand who's sitting in front of you and that you're respecting all of who's sitting in front of you, regardless of what that looks like. So we really need to begin to focus on acknowledging, understanding, and respecting individuals' lived experience. And as we mentioned earlier, we have to start a process by which we are embracing discomfort, talking about some of these issues, particularly issues that impact Black and Brown people, are not comfortable conversations to have. They create a level of discomfort that causes many providers to avoid the discussion altogether. Talking about racism is not easy. It's uncomfortable, but we have to. There's an elephant in the room, and we cannot walk around that elephant, try to avoid the elephant. We need to partner with it and walk through it together, because those are the very stressors and traumas that impact the person that's sitting in front of you, and you have to deal with it regardless of how uncomfortable it makes you as the provider. Community engagement and advocacy are key. We have to engage our communities. We have to move away from everything having to happen in our offices. Everyone does not have to come to the ivory tower to get treatment. Why can't we go to the community and provide services? Why can't we partner with communities and learn about communities and what strengths they have to offer, what resources they have to offer that can inform our treatment plans to help our patients? They live in these communities. They spend more time in their communities, in their neighborhoods, than they do with us 45 minutes once a week or every other week. So we have to begin to think more critically and intentionally about community engagement and advocacy. Our patients need to find their voice, use their voice, and stand up for themselves against all of these structures and stressors and things that are impacting their mental health. And I feel like as a mental health professional, it's my job to take that journey alongside them and promote that. So switching from object to subject in the liberation-based practice approach is what we're grounding the remainder of this presentation in. Next slide. When we're talking about these evolutionary practices, and Tanisha and I, when we were planning this presentation, we went back and forth about how should we present this, what should the title be, and we really thought that we need to evolve. So we need to talk about evolutionary practices. And so we started thinking about, well, what does that look like? And if we were in a perfect world and we had all the resources that we need, what would that look like? And so we came up with a few examples for you. And the first thing that I'm a big proponent of is strength-based approaches. We have to move away from this deficit model of interacting with patients and going and developing treatment plans. So the first thing that you say to your patient or client, and I apologize, I use patient a lot, but I'm using it interchangeably with client or consumers of mental health services. So I apologize if that term is offensive to anyone. But the first thing or the first thought that you have in your mind as a provider should not be what's wrong with you. It should be, let me understand who you are. What strengths do you bring to the table? What can we use that you already possess to help you along this journey? But we oftentimes approach it from a deficit-based model, so the patient or client is defeated before they even start the process. And so one way to really promote strength-based approaches is to ground your work in this liberation-based healing model, become more collaborative, and build partnerships with your patients and clients. They should be your partners. They're subjects, they're not objects. They should be your partners, and you two should take this journey together to understand how to best help that individual. And we need to do a better job of elevating their voices. Their voices should be in that room. They should feel that room, and it should be the most important thing in that room. They know themselves better than we could ever know them. So if we don't allow them to voice their concerns or even tell us who they are as intersectional human beings, I feel that we're doing them a huge disservice. And then something that I always do with my patients or clients is unpacking the baggage. And to me, that means that they walk in and there's a lot of baggage. They're so heavy, they're bent over because they're carrying baggage. And some of that baggage belongs to them, and that's what we deal with. Some of that baggage does not belong to them. So my job as a psychologist is to help them sort that baggage, understand what's yours, what's not yours, and what do we do with these packs, these piles of baggage. What belongs to you, we're going to pick that up and deal with that stuff because we need to deal with it. What doesn't belong to you, we're going to place it where it belongs. And that doesn't mean that you ignore it, because a lot of what does not belong to them are structural forces that are beyond their control. So we need to help them acknowledge and understand that, but also let them know that it's okay to put that down. You don't need to carry other people's stuff. We need to work together from an advocacy perspective to deal with that stuff. But because they're carrying so much baggage, it's hard for them to even stand up straight to see what is their own stuff. So we really need to help them to unpack, sort, and deal with that baggage and acknowledge those structural forces that impact mental health. Next slide. And beyond talk therapy. So another thing that we're starting to do in our clinic is to think about, okay, what we're doing historically has worked for some people and it hasn't worked for some. So how can we become more innovative in what we do? And so we've developed some innovative wellness approaches. And so we're trying to integrate things like narrative-based therapies in our work, arts-based therapies that center around music, nature, mindfulness, well-being, poetry, things that really speak to the souls of some of our patients so that we can then figure out how to integrate those things into a treatment plan. Because the goal here is that we want to meet them where they are. And sometimes doing this type of work means we may need to go to the community to do this, because communities have beautiful resources and centers that are already doing this work. So if we're able to partner with them, imagine the transformation that could happen with some of our patients. And also, we want to be collaborative and we want this to be self-directed. The goal is not for patients and clients to be reliant on mental health professionals for the rest of their lives. The goal is that they learn strategies, techniques, and things, coping skills that they can use on their own, self-directed, so that they can heal and move on. And if they need to come back for a refresher, great, but they shouldn't be relying on us for the rest of their lives. But because of the way it's currently structured, it's difficult for them not to be. So that's why we have to begin to think more innovatively with regard to wellness approaches, because at the end of the day, we want to focus on agency and accountability. Next slide. And then Tanisha will speak to some workforce strategies that we feel are important.
Absolutely. And so as we talk about making sure that we are evolving, we just showed the slide previously around the workforce. And so one of the things that we want to amplify and elevate is diversity attracts diversity. The first thing that I'm doing is looking at the company's website. Are there people that work there that look like me? Are they in leadership? Are they on the board? What is going on at that organization? Are the only pictures I see that look like me a part of the juvenile diversion program or the prison outreach program? That is a problem. And it's also a problem if you have an organization that has been around for years and they just are hiring their first Black person or their first brown person this year or last year or around George Floyd. that requires us to have a conversation. And I said, fix the foundation. What has happened in the legacy of this organization that you are just now hiring your first Black or brown person, or you promoting the first Black or brown person into leadership? Something has happened, and it may look like a promotion on the outside, but if the foundation is not fixed, it's going to become a cycle of people cycling in and out. So it's important to have the conversation around how the organization was founded and what principles are we still holding to that may have existed in 1920 and 1800 when the organization was created. Also, taking care of your people. And I hear a lot about this, about we don't have enough money to pay people. There are other things that you can do. There are flexible scheduling. There's treating people with dignity and respect. That goes a long way. Good morning, good afternoon, please, thank you. How are you doing? How's your family? How can we support you as you're going to school? And various things. And that requires organizational accountability. How do we take responsibility for the things that are happening within the organization? If you have a high turnover, what is the organization doing about it? If certain groups of people are not coming for services or they're experiencing poor outcomes, what is the organization doing about it? And what are our expectations? Do we expect that certain people just don't come? And when they don't come, we're okay with it? We should not be okay with it. How do we take those things and cultivate community partnerships? So I always say, don't dilute your sweet tea. There are things that your organization does and they do it well. And there are things that exist and needs that exist beyond what your organization provides. Who in the community does that and does it well? Who in the community does that sweet tea belong to? And how do we partner with them and pay them equitably to support and provide services to our clients? And so I know we could go on and on about this topic, but we are limited by time. And so before we close out, what we want to do all the time is we want to avoid just having a lecture or just having a conversation. We really want to move this into action. And so our next thing is a call to action. So we know that the breakout time was short, and we know that this has been a lot of information in a short period of time, and we appreciate you all sticking with it and staying in with us. And so we're going to enter into a chatterfall. So in the chat box, share one specific action that you can and will implement within the next 7 days. And so type it in, do not press enter, and then we're going to do a countdown, and we're going to have everyone press enter at the same time. All right, we're going to count down. 5, 4, 3, 2, 1. Press enter. All right, so I see listening, connect with the plan, a lot of listening, engaging in outside community, asking questions, peer support, engagement and leadership, training. Thank you all so much. And again, we know that we could have talked about this forever. We're going to open it up. I think we have a moment for maybe one question, but we'll open it up for any questions, comments, or discussions. If you have a question, you can also put it in the chat, and we'll do our best to respond to those questions as we move forward with follow-up material and activities. And we're going to close out with this quote from Dr. Maya Angelou. We need joy as we need air. We need love as we need water. We need each other as we need the earth we share. And so again, thank you so much for participating today. Cindy, I will turn it over to you. If anyone has any questions, please raise your hand and we'll try to get to it today.
Wow, thank you for the amazing presentation. That was incredible. For those of you looking for more resources, please feel free to visit the NTTAC website. And also you will be receiving an email after this presentation and with more information. The next meeting will be the 21st of March. So we hope to see you all there. We thank you for participating on behalf of NTTAC and the presenters. We hope you have a fabulous day and continue the great work I'm sure you are all doing. And that's it.
Wonderful.
Appreciate you all. So
Thank you, Dr. Foster. Thank you, Dion, and everyone.
Thank
Thank
you.
you, Jamie.
Thank you.
Yeah,
Thank
and
you.
also Evelyn, they're making this possible. I didn't see her, but please send my love to her, and I look forward to collaborating with you all later on in a different capacity.
Absolutely.
Absolutely.
And thank